COVID-19 seems to be staging a comeback in parts of Asia, and India is not taking any chances. A sudden spike in COVID-19 cases in Singapore and Hong Kong has prompted the government of India to sound the alarm. While most cases reported abroad are of mild nature, Indian health authorities are preparing in advance to prevent any serious spread. A high-level meeting was chaired by the Director General of Health Services, reviewing preparedness and surveillance strategies across airports and hospitals. Meanwhile, COVID concerns are also hitting pop culture and sports headlines. Reports suggest that Sunrisers Hyderabad batter Travis Head has been ruled out of IPL 2025 after testing positive. Adding to the list, actress Shilpa Shirodkar also revealed on social media that she has tested positive. The Health Ministry is urging citizens not to panic but to remain cautious, especially during travel or if they show any flu-like symptoms. India, viewers, is increasing genomic surveillance and ramping up hospital preparedness as a precautionary step, with states likely to be advised on public health readiness. All right, let's take this discussion further. I'm joined by Dr. N.K. Arora, Chair President there, AIMS, Deoghar. I'm also joined by Dr. Anil Gurtu, HOD, Medicine and Chair, Infection Prevention and Control Committee, Sitaram Bharti Institute. A very warm welcome to you both. I'll start with you. Dr. Arora, do tell us, what's really driving the recent surge in COVID-19 cases in India and other countries like Singapore and Hong Kong?
Thank you very much for inviting me. The important point is, what is the variant which is associated with this new surge? So as far as India is concerned, JN1 is one of the last ones which has been persisting since August 2023, and it's the same JN1, and it's a kind of a progeny which is circulating globally. Also, JN1 is the key one, and there are several offshoots of JN1. 2 weeks ago, there was a meeting, a global meeting, and again it showed that it is the JN1 which is the predominant, and with some of its the other variants which are. All these are not associated with major increase, any significant increase in severity of disease, because that is what is of concern to all of us, whether hospitalizations are there or whether it is associated with that. But none of these features have been seen in other parts of the globe. So we are also waiting that what is the variant which is causing the upsurge in Southeast Asia, Singapore, and other countries. One of the reports mentioned about JN1, but as I said, JN1 also has a lot of subspecies, and one will wait till that. Meanwhile, I must also, as you very rightly said in your opening remarks, India is ramping up the surveillance activities and genomic surveillance. And we should be also ready with what is the current circulating subvariants of JN1 in India.
So, right, continue to stay with us, Dr. Arora. Let me quickly go across to Dr. Gurtu. Dr. Gurtu, do the current cases look any different, symptom-wise from what we witnessed before?
The current upsurge is that of all influenza-like illness causing viruses. Influenza A, there are two of them, H1N1, H3N2. Influenza B, one of the variants, respiratory syncytial virus somewhat, and adenovirus, and among them some COVIDs, which, as Dr. Arora rightly said, are all ancestral variants and subvariants that have emerged from the common Omicron virus that first time emerged sometimes in November 2019. So currently what we are seeing in our hospital and other hospitals are ILIs, influenza-like illness, running nose, pain throat, fever, headache, body ache, severe fatigue and malaise, sometimes diarrhea, and 3 to 5 days, but followed by some fatigue for some time later. So this influenza-like illness, and a small component of that is COVID. The larger component is influenza virus A, mostly, two of them, and some B. So the second question you asked, are the symptoms different? In somewhat, yes. One, they are much more attenuated or milder versions of even the last year's variant. One. Two, this year, unlike last year, we are not seeing a loss of taste and smell as a result of this infection. So, on the whole, of the total universe sample of viral influenza like illnesses, COVID Omicron variant is a small subset, not large enough. B, it is causing very mild, common cold like illness, which recovers on its own. And this year, we are not witnessing severe illness, and we are not witnessing loss of taste and smell, unlike past. Thank you.
All right, continue to stay with us, Dr. Gurtu. Dr. Arora, should people sort of consider getting booster shots now, even if they had their last dose several months ago?
So important point, as in continuing with Dr. Anil Guptu is saying, that it is the severity of illness, which is and that is why I would say not to get panicky. We don't see more severe disease or which requires hospitalization. It's a mild influenza-like illness. Now, this question of boosters or precaution dose. In fact, most of us got our precaution doses in 2022. So almost over 2 years now when we got the precaution dose. But we should also be kind of aware that most of us have been having repeated infections, and some of these infections might be COVID. These are all mild illness, and now the testing has also gone down significantly. Hardly anybody gets testing for COVID. So overall, even according to WHO, the booster doses are recommended only for those who have comorbidities. But again, the vaccine, which is to be aligned with the current circulating viruses, is also required. But overall, our feeling is from the national perspective that at the moment there is no need for panic. And similarly, we don't recommend any booster vaccines for COVID.
All right. All right, continue to stay with us, Dr. Arora. Dr. Gurtu, the Health Ministry has urged people not to panic but to remain cautious. Do tell us what precautions should people take, especially now that we're already in the travel season.
So carrying forward where Professor N.K. Arora left off, he also emphasized on the word, do not panic.
Absolutely.
So I will not, so taking off from there, the question before us is, what can I or we do to protect ourselves from acquiring any influenza-like virus, any virus that causes influenza-like illness, not only COVID, also influenza, which is vaccine preventable, and other viruses which cause influenza-like illness. So common and generic to all of these are the standard universal precautions, which are three. One, and the most important and the most cost-effective and cheap, hand washing. Wash your hands before entering a new room, after leaving the new room, after touching surfaces. And how do you wash? Simple soap, simple water, nothing more. Where that is not feasible, use hand sanitizers with a minimum of 70% alcohol based hand rubs. Uh, Hand wash prevents almost so many infections that this is more effective than any vaccine or anything else. Hand wash, all the moments that are required. We must be vigilant. One. Two is droplet precautions. That is, if we are unwell or we come face to face with someone who is unwell, having a fever and throat and nose and coughs and all those things, then maintain a distance, as we say, an arm's length. That should be enough. And the sneeze cough etiquette. Ideally, if I am having fever and influenza, I should be with a mask when I go out in contact with other people. If that is not possible, then I should maintain what's called the cough and sneeze etiquette. If I have to cough, I don't cough into bare hands or into open face space in front of someone, but cover it using the bent elbow for sneezing and cough. And if I'm unwell, I should be with a mask, surgical mask, not N95 now. The third is the airborne precautions. Micro droplets, which are less than 5 microns, they remain suspended in air. So those are dangers in enclosed spaces with poor ventilation. So when in a crowd where some people could be infected, there's someone sneezing, coughing, it's best to open up the ventilators, windows, and create cross ventilation across the space. And maintain good immunity, which means 30 minutes of daily outdoors exercise, avoiding the peak heat hours these days. So 5 to 7 a.m. is the right time because the heat stress is also around these days. So exercise, daily exercise, 30 minutes, anything, walk, run, jog, cycle, swim, whatever, or just simple walking. It builds immunity. A healthy diet, rich in greens and plant foods, and good sleep, 8 hours. So these are enough. Build immunity, practice safe hygiene practices should be more than enough. Nothing more is needed. It's common to everything, preventing against everything. Thank you.